Welcome to The Cancer Nurse. First episode, so you have cancer, now what? Before we get into all of the good stuff, I just want to remind you that anything shared in today's video is just helpful tips, is not meant in any way to be medical advice or a replacement for a conversation with your oncology team. Also, if you want to be a part of our community, simply to support the channel or to meet and join in with other people who are going through cancer treatments, there's a link below for our Patreon community. I think there's two things I want someone to know who just found out they have cancer. The first thing is, one, you're not doing this by yourself. Even if you physically are by yourself, you don't have a significant other, you don't have any close family or friends. I have patients that exist that literally have no one. You're not alone because you have your support team. You have your cancer treatment team, whether it consists of a doctor, of a surgical physician, of nurses, of medical assistants. There's a whole team of people who are there to support you and help you through this, and you don't have to do this alone. Also, the other important thing, you get to make the decisions. All of us here on the medical side are going to be like, we really think you should do this, and this chemo is really important, or this radiation is really important. But ultimately, it's your choice. You get to drive this ship. You are the one who's going through this experience, through this treatment, through this diagnosis, and you have every right to say, I don't think I want to do that, or I really do want to do this, or I want to do this part of it, but do we have to do this part? And then it's also your responsibility to ask the questions. So if your doctor is recommending that you do concurrent chemotherapy and radiation therapy for your cancer diagnosis, and you say, I don't think I want to do radiation, I just want to do chemo, you got to ask that question. What happens if I don't do radiation? What happens if I just do the chemo? Or vice versa. What happens if I just do radiation and I don't do the chemo? What are the outcomes? What's the survival rate? Those are the questions you have to ask. But ultimately, remember, it's your choice. So let's talk about your care team. What is a care team? What does a care team look like? It's going to vary from provider to provider, from different organizations across the country. But your care team is very likely going to consist of a medical oncologist, someone who does the chemo side of life. It's going to consist potentially of a radiation oncologist, that's the radiation side of life, and also very likely a surgical oncologist. The order in which you see those providers and have those consultations depends heavily on your diagnosis and your cancer type. Some of you will see only a medical oncologist. Some of you will see a surgical and a medical oncologist. Some of you will see all three. Some of you may only see a surgical and a radiation oncologist. But those are the key members of your provider team for your oncology experience. On top of that, you may or may not have somebody called a nurse navigator or a nurse case manager. And you will also have infusion nurses in the medical oncology side of life. You'll have radiation nurses and you'll have surgical nurses. Sometimes there's even subspecialties like a breast cancer nurse navigator. Something important to remember when you go to consults is to take a pen and a paper and or some type of telephone recording device, because you're not going to remember everything they tell you. So it's really good to take down some notes. It's also really helpful if you have questions before you go to write those out so that you don't forget them. Because if you're like me, you show up at that first visit and you ask maybe one or two questions, and then the doctor gives their spiel and you're completely overwhelmed by all the information. And then you get home and you're like, oh crap, I forgot to ask about blah, 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 blah. So if you write down those questions beforehand and take them with you, it really helps you to not forget what you're asking about and what you wanted to ask about before you leave that visit. Something to keep in mind is your oncology team is going to give you lots of information and lots of details. It's important that you hear all of that out so that you can make the best decision for you with all of the information that you have. If you have questions, ask them. If you want to go home and do some research or do some talking with family and friends about what all of your options are and what might be best for you and your family, that is absolutely reasonable, and I would advocate for you to do that before you make any final decisions about what course of treatment you'd like to go through. So when you go to that consult, if you have not already been in touch with someone who's called a nurse navigator or nurse case manager, ask your provider about those things. Hey, is there a nurse manager or is there a nurse navigator that I can reach out to? Is there a point person for me as the patient that I can call or send a message to if I have questions or concerns? Also ask about financial resources. Most medical entities at this stage have some sort of financial resource available to you that you can apply for to get help with paying for medical bills if you do need that assistance. Some organizations have cancer counseling groups that they can refer you to, or cancer counselors they can refer you to. They also may have cancer support groups that they can refer you to. It's really important that you ask what resources are available to you, covering the whole spectrum, whether they're emotional support resources, financial resources, just navigation resources, whatever those are, ask what those are so that you know what resources you have available to you. Because I promise you, there are probably a whole lot more resources available to you than you even are aware of. So when you go to your consults, and any follow-up visits for that matter, if you have a family member, a trusted friend, someone that can go with you, and if they can't physically be with you, for example, my parents live out of state. If you can be a part of the visit via a phone call and put them on speakerphone, it's always good to have at least a second set of ears to hear everything that the provider is going to tell you, because each of you is going to remember something slightly different about that visit. So you might remember that they said chemotherapy, and the other person might remember they said chemotherapy and immunotherapy, or chemotherapy and radiation. And then when the conversation's done, you two can kind of get together and be like, okay, wait, this is what I remember, blah, 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 and this is what I remember. And then you get a better picture of what that visit actually entailed and all the details of that visit. Thanks for tuning in and hanging out with us today. We'll see you next time on The Cancer Nurse.